Let me see if we're starting. I still see the slate. When I see us pop up, I'll start with you guys. All right. I think we have started. I see us on YouTube Live. We're on Facebook Live. Hi, everyone. I'm Stephanie. I'm with 9Health. We are hosting a virtual town hall in collaboration with 9 News. Let me turn off my speaker. In collaboration with 9 News, we are hosting this town hall just to get you information that you need about coronavirus, COVID-19, connect you with experts so you can ask your questions. So please comment with your questions. I'll be checking my phone on Facebook, so if I look down, don't think that I'm rude. I'm just going to check and see if we're getting any questions. But first, I want to introduce who we have with us right now. We have 9Health expert Dr. Pyle Coley. If you want to say hi, she will pop up and you'll be able to see her. She's also on the side of your screen. And then we also have Joshua Zucker, who is a nurse practitioner specializing in geriatrics and gerontology, which is great, and family medicine, which is great because it is affecting older adults and really just affecting all of us. So it'll be great to have you answer some questions as well. But let's just start with Dr. Coley. I'll start with you. We've been talking about testing, maybe the lack of testing. Can you kind of tell us where we are right now, where we stand?
Yeah, so I think there's been a big change in our mentality about testing just in the last couple of days as physicians. So a few weeks ago, we were saying if you're having any symptoms at all, make sure you call your doctor and ask whether you need testing. Now, the reason we were saying that was basically to try to get a sense of what the virus is doing and how it's spreading and where it is. Now at this point where it's in all 50 states, we have over 7,000 cases in the country. It's been a shift in the medical system from the standpoint that we don't really need to know whether or not the virus is in the community because we already know that. And the testing is not really going to help us change your treatment course or change, anything that we're going to do in your care. So now what we're telling people is that if they're having mild symptoms that you think you can manage at home and you're feeling pretty well otherwise, it actually exposes you to more risk to come to a doctor's office to try to get testing. Instead, you should just assume that you have the virus and, isolate yourself at home in such a way as if you have the virus to protect your family members and your friends. And just kind of, take the things that you usually would take, like over-the-counter cold medicine, Tylenol, drink plenty of fluids, and get plenty of rest. The time to really call your doctor and seek medical care is if your symptoms are progressing, they're becoming more severe, or if you develop shortness of breath. So that's the big red flag is shortness of breath. So, fever, cough, it's kind of usual with the flu or with the coronavirus. But if you start to have shortness of breath, trouble breathing, then it's really time to pick up the phone and call your doctor.
I agree. This is Josh Zucker. I'm a gerontologic nurse practitioner. I absolutely agree that the big, it's like most other viruses, it's going to affect you. But if you're having difficulty breathing, that's where we want to step forward and make sure.
We did have someone just join us. We have Dr. John Hammer, who is an infectious disease physician with Rose Medical Center. So thank you for joining us, Dr. Hammer.
My pleasure.
We're kind of talking about testing right now. Can you chime in a little bit and tell us what you're seeing so far as testing or lack of testing, and maybe help with the confusion as when people should go get tested, how that works?
Right. Well, at the present time, you mentioned lack of testing. That's what I'm seeing most of still right now. We're seeing pretty serious kind of ongoing delays from tests that have been sent to the state health department. Usually, even for our inpatients and our healthcare providers, we're seeing turnaround times along the lines of typically somewhere between 3 and 5 days, which has been difficult to deal with. And we've had to just kind of make do and deal with the uncertainties around that in terms of our use of protective equipment to protect our healthcare providers, et cetera, pending those results. It's our hope that the commercial labs such as Quest and LabCorp will be pitching in over the coming weeks, days to weeks, hopefully, and help to alleviate that burden. The public state health department has been overtaxed in terms from the start, really, and they can't really be expected to shoulder testing for the entire state by themselves with a limited capacity. So We hope to see some changes here, but it's tough. And when it comes to what to do if you're an outpatient, if you're at home and you have symptoms and you're concerned, I think at this point in time, to be honest with you, I would, if you have concerns about COVID, I'd recommend staying at home, self-isolating, acting as if it could be COVID. In most cases, 80% or more, it's a mild disease, especially if you're younger and otherwise healthy. If you are getting sick, however, if you are developing shortness of breath or cough, as I think was mentioned as I joined, if you're having ongoing or worsening symptoms, that's when you might want to consider going to a facility, to an emergency department to get tested.
Right. Okay, and we are taking questions on Facebook, on YouTube Live. If you have questions, please post them. Let's go to Facebook for a moment. Someone just asked, they keep saying seniors are at risk. So Joshua Zucker, I'm going to put this to you. They keep saying seniors are at risk for serious illness. I'm 67. Does this mean if I get the virus, I will get hospitalized or very sick for sure? Or are most seniors okay, can be treated at home?
Well, the seniors as a general population, we're a little more concerned about, because it seems to affect our seniors more so than younger populations. I would say that really depends on your overall health status and how you're affected by the illness. So I would not automatically assume that you're going to the hospital. We're hopeful that supportive measures, lots of fluids, Tylenol, which is acetaminophen, and cold relieving symptoms would help with your symptoms, hoping that it will be a mild case. So by far, no, most people who are older are not likely to end up in the hospital. So we're hopeful that we can help provide supportive symptoms. Things to avoid when you're older are products that contain Benadryl or diphenhydramine, because that can be harder on the older population. But I think that keeping an eye on your own symptoms, making sure you're doing okay yourself, we're very much hopeful that you can manage this on your own. But certainly if you're older, it doesn't mean you're absolutely going to the end of the hospital. So do what we can to keep you comfortable at home.
Right. I mean, I think the message to take away is it really can affect any of us in any capacity, just depending on your overall health. Dr. Coley, someone asked, they've been hearing about ibuprofen, that it worsens the condition if you get coronavirus, have COVID-19. Can you just answer that question, talk about that a little bit?
Yeah, so just to clarify, the study is based on an animal model where they actually saw that ibuprofen can potentially increase the expression of a receptor in the lungs that the virus uses to enter the lungs. So it creates more doorways for the virus to get into the body. So not so much that it worsens the infection, but more so that it increases the susceptibility to the infection, again, in an animal model and a theoretical sense. But there's some debate amongst experts whether this is just a theoretical risk or this is actually a real risk. And people are divided as to what to do. In Europe, certainly they're recommending not taking ibuprofen because of this potential theoretical risk to increase susceptibility for the infection. Instead, they're recommending things like Tylenol instead. So I would say it's probably safer to take Tylenol while we're still learning about the behaviors of the virus. But at this point, there's no definitive guidance as to absolutely avoid ibuprofen. The other thing with ibuprofen is that it can also have effects on kidneys and other things as well. So especially in the elderly population, there can be other side effects of taking non-steroidal anti-inflammatories that can also be concerning.
As a general rule, we try to avoid the non-steroidal anti-inflammatories like ibuprofen and naproxen or Aleve because of compromised kidney function as you get older, along with other chronic illnesses. Absolutely agree with Dr. Coley.
Okay, and Dr. John Hammer, I want to bring you into this for a moment. Did you have something to say about ibuprofen as well?
Yeah, I agree with what's been said so far. I think that the data, we don't have human worsen symptoms, but there are concerns, some via animal models, but also no, especially in the setting of dehydration.
Okay, you cut out a little bit there, but I think we all kind of get the idea. I did want to ask you, someone asked, since you're the infectious disease doc that we have with us right now, someone asked about, containing the spread. We're still allowed to go to grocery stores. People are kind of still in close proximity when they're, shopping for groceries. How do we protect employees and even when we go out to go shop?
That's a great question. I think that the important thing to do when you're out, you do have to get food, and that's and it's important to go outside. Let me just back up for a second and say, going outside, going for walks, the weather's getting better. Those things are all, going for jogs, going for bike rides, all that's fine. When you go to the store, you may be at risk of being closer to other people. We try to we say try to maintain that 6-foot radius from other people, and you can space yourself out in line and try to maintain that. Remembering that, when you pass somebody in the aisles and the aisles are narrow. Hello? Am I still there?
Oh, sorry. I think we had a noise on another. It popped
Okay.
over. Go ahead.
So that brief, passing in an aisle, et cetera, is not a high risk activity. I mean, we're talking about 6 feet, but for a prolonged period of time, more than a couple minutes. So I think it's fine to go to the store. It's important, though, to bring your hand sanitizer when you do go to the store. When you touch objects, when you touch countertops, you really want to gel up and wash your hands probably several times through the course of a trip to the store and when you leave.
Right. I even thought the other day when I brought some groceries home, I set them on the counter and then they were in the bag. So then I need to go and disinfect the counter because it can live on surfaces for a certain amount of time, correct?
Yeah, exactly. So a recent study that was published in the New England Journal of Medicine basically showed that the virus can survive for up to a day, for up to roughly 24 hours on cardboard surfaces, longer on metal and plastic surfaces, up to several days in that setting. And so, yeah, I think that it might be reasonable to reconsider how we unpack our groceries. You're not going to be able to sterilize the boxes or clean those. But what you might want to consider doing is unpacking your food, washing hands kind of in between unpacking various items. And then when you're all done, dispose of the items in trash or recycling, then wash your hands again for a good 20 seconds with soap and water. I also try to avoid setting packages on the counter, as you said. I usually try to unpack from the floor.
Right. And Dr. Cole, on that note, I just kind of wanted to ask this. I thought about this today. I've been in my house for the whole day. I keep disinfecting my house, but none of us have left. So how often do we need to keep washing our hands if we are staying in our homes? Should we just be practicing, general hygiene after we go to the restroom, or is it, just kind of a common sense thing? But I just thought about it. I'm like, if I haven't left, how often do I need to keep washing my hands?
Yeah, so you bring up a good point, which is really that the primary source of infection comes from interacting with others and then contaminating surfaces. But it is important to wash your hands regularly, I would say. And certainly, as you pointed out, after you go to the restroom, but also because we have a tendency to touch our faces. And there have been studies that say people touch their faces, 24 times every hour. And that is a habit that a lot of people have and don't even realize. And similarly, when we're eating and things like that. So I would say, even if you haven't left your house, important to wash your hands before and after the bathroom, after you eat and before you eat, and then especially regularly during the day, because you may be touching your face more than you realize, and maybe interacting with contaminated surfaces like your tablet or your phone.
Okay. And we are getting several questions about asthma, underlying conditions. How worried should someone be if they're asthmatic that this could be something very serious for them?
So asthma is certainly considered one of those high-risk groups for sure. And I really tell my patients that if you're the type of asthmatic who, whenever they get a cold or infection, it gets into your lungs or it gets into your chest, that heightens my level of worry just a little bit more. But in general, all asthmatics should really consider themselves in that high-risk group and really be careful.
And Joshua Zucker, I want to put this next question to you. A few people are asking about symptoms in children. I know you do geriatrics, we also do family medicine, and just kind of symptoms in general. They're saying, if their kids have a runny nose but no fever yet, what should they do? How should they know if their baby is struggling? Babies can't really tell us they're struggling.
Sure, I think that the hallmark signs we're looking for: high fever, we're looking for that dry cough and the shortness of breath. So if the kid has, children have harder working of breathing, that they seem to be panting a little bit more, they seem to be using the accessory muscles around the ribs and around their throat, looking like they're having a hard time breathing, that's when you want to reach out to your healthcare providers. You want to make sure that they're involved. But if they have a runny nose, and that may lead us more to other more common viruses, may not be as concerned. But that, want to make sure that we're keeping an eye on all aspects of the population. But it seems to be that the numbers have come back so far. It seems that our elderly are the most at-risk population.
Right, and Dr. Hammer, we've talked about this several times on 9 News, 9Health, the difference between coronavirus, COVID-19, and the flu. Some people are calling it respiratory flu in our Facebook comments. Can you kind of just talk about differences, what it is exactly?
Well, the coronavirus it's a completely different virus than influenza. Coronaviruses, there are four types that circulate around the world and in the United States that we've all probably been exposed to that cause the common cold. Those are usually relatively benign diseases, almost uniformly. But what we saw first in 2002 and 2003, then again in 2012 and to this day, with the evolution of the original SARS virus and then the MERS virus, which is a Middle Eastern variety, these viruses can occasionally mutate and change into a virus that can, first of all, infect humans. They're typically bat viruses, or they live in bat populations. They develop the ability to infect humans, but they also have the ability to cause more severe disease. And by that, I mean, they're able to, instead of just causing upper respiratory tract infection, they can enter through receptors, as was previously mentioned, in the bronchial tree and cause pneumonia. So typically, we only see the pneumonia in elderly or patients with underlying medical conditions. Interestingly, we rarely see it in kids. I think of the 80,000 or now more than 100,000 cases in China. It was very rare in patients under 15 to see disease that led to hospitalization. What we probably are seeing in kids is colonization with the potential transmission. Hence, that's why school closures will hopefully be helpful in terms of reducing spread of the virus. But we don't see disease in kids. Influenza is a seasonal virus that changes every year. It mutates, or different strains will become predominant. And so we have to design, we do have vaccines every year. We try to anticipate which strains will be predominant that year. But it tends to cause, seasonal flu. Usually tends to be a winter epidemic every year, circulates in the winter in the northern and in the southern hemisphere. It has a mortality that's probably lower, probably somewhere around 0.1%. It appears that this coronavirus mortality is going to be somewhat higher than that. It tends to affect the elderly and the very young. Again, the coronavirus doesn't really affect the young that much, at least so far that we know of. And it tends to, usually when the elderly die of influenza, they die of complications of influenza. So influenza is associated with the death of 30,000 or more patients a year in the United States alone. But typically, most of these are older patients or patients with other diseases.
And Dr. Hammer, since I know you can only stay with us for a few more minutes. People are asking on the Facebook, what caused the virus? Since you're our infectious disease doc, I kind of want to let you just touch on what caused it. Where did this all come from?
Well, despite some rumors to the contrary that this is like a Chinese conspiracy and leaked from a biocontainment lab there, the actual genetic analysis of the virus shows that it's a natural evolution from likely a primary bat virus. Bats, the coronaviruses live in bat populations that circulate. They may infect other animals. There may be an intermediate animal. And basically, when it comes right down to it, it's the interaction or increasing levels of interactions between humans and these animals. That's what you see with a lot of vector-borne and non-vector-borne diseases. That basically people are getting more closer to animals. In the setting of China, they have the wet markets or the seafood markets where they have a lot of Chinese animals that are actually kind of interesting, but could be infected, could be the vector. They perhaps are eaten, perhaps it's through direct contact. We don't really know. But typically, like SARS virus, we think that the genetic mutation occurs there, and the first humans are infected there, and then it takes off.
Okay, and Dr. Coley, and Dr. Hammer, before I let you go, there were a couple concerns that you coughed, so we hope that you're okay and that you wash your hands.
I was clearing my throat.
Yeah.
No cough here.
Okay, so everyone, Dr. Hammer is okay, and he will go wash his hands.
I'm good. No fever too, although
no fever. That's good. So, Dr. Coley, I wanted to ask you again to kind of go over symptoms. People are asking if I have everything except for the fever, is it coronavirus? If I have just a cough but not other symptoms, is it the coronavirus? When should people call their doctors, be concerned?
The symptoms can be widely variable. Some people are completely asymptomatic, have no symptoms at all, and others will have the classic triad of the fever, the cough, and the shortness of breath. So it is possible you could have any combination of those and still potentially have the coronavirus. But as we said in the beginning, given the limitations of the testing at this point for widespread use, which is really what we had hoped to do, when the testing first rolled out, but it just doesn't seem like it's going to be a reality. If it is mild symptom, then it would be recommended to sort of assume that you probably do have the infection, or maybe a higher likelihood that you have the infection, and just stay at home and manage your symptoms themselves.
Okay, and a few people are asking about an update on where the vaccine is at. I can let anyone who would like to answer this answer. I don't know if Dr. Hammer, you want to start on where the vaccine's at? Dr. Cole, I know you talked about this on air earlier this week.
Yeah, as far as I know, there's one vaccine that is now in phase 1 human trials. That's where we look at initial dose response and safety. The issue with vaccines is that we have to do these trials to, number one, ascertain as to whether the vaccines actually work and stimulate effective antibodies in humans, and also number two, make sure that the vaccine is safe and there are no associated side effects. These studies take months, and it typically, as far as I know, the soonest we're going to have a workable vaccine out might be probably a little bit less than a year from now, hopefully in the winter of 2021.
Dr. Coley, same question. That's kind of what you were saying earlier this week. So again, people are talking about not having enough tests. Joshua Zucker, I want to ask you, I know you work where they do a lot of virtual healthcare. So talk about how, I guess, that does work, especially in a geriatric population. We're telling people not to go to the doctor. They need to call first, then maybe they get their doctor's orders or doctor's note virtually to be able to go get a test. How does that process work?
Yeah, it's a process where I'm lucky enough to, part of my responsibility is doing house calls for those who are too frail to come to clinic. So we're making adjustments as we go through, but a lot of big healthcare systems are converting over to a virtual healthcare system. So utilizing video visits, using telephone visits, able to use those resources we have, leverage the technology we have, making sure that we're utilizing all the resources we have. So making sure that, talking with your providers over via the video, if you don't have to come in, then let's make use of those resources. But a lot of the appointments are changing over to the videos, where you can ascertain a lot of information, get a lot of information to be able to provide a lot of support. Call in prescriptions, we can call in diagnostic testing as we need to, but really each healthcare system is doing their best to try to keep up with these resources that are limited because we don't have enough. I know that a lot of healthcare systems are paring down to just a certain number of clinics rather than all the clinics, just be able to make sure we have the best resources for those people. But if if you're healthy enough to stay at home, please do that. I think the big concern of the healthcare system with the suppressing the curve is making sure we're not all running to the emergency department at one time. Let's be thoughtful of our fellow citizens and make sure that we can utilize if we don't absolutely need the face-to-face visit, let's make use of those other options.
Yeah, I might also.
Oh yeah, go ahead, Dr. Hammer.
I might also just add quickly that if you are going to a health providers to an office visit, and let's say you're going for some other reason, but you have a cough or a cough and runny nose, call ahead, please, and let that office know that. It's really important because a lot of our providers don't have the personal protective equipment in the office to protect themselves, and they may want to reschedule that visit to another time. And it really is, one person going into an office and potentially infecting others, even with the potential, multiple people could have to stay home and it could shut down the office. So we really need to be careful about how we interact with our healthcare providers so we can keep the system up and running.
And is it really hard to even know where we stand? Someone said, we need to mention that we're really not testing that many people. So it's hard to say for sure how many cases we have. But then also, the numbers are still going up every day because we are testing some people. We just aren't testing enough.
Right. Well, the more we test, the more we'll find. But I share with, I'm sure, the other participants here that a real frustration with the inability to test. It's believe me, if you can't get tested at a facility, don't blame the healthcare provider. They're trying to do the best they can. We're all terribly frustrated by the current situation.
And then Dr. Coley, I wanted to take it from testing to just talking about social distancing. A lot of us are practicing that. 9Health employees are working from home. as much as we can. A lot of other people are as well. We went for a walk today as a family. My son wanted to play on the playground, and someone just asked, can I take my kid to the park? Can we go to the playground? What should we be avoiding still? Can you kind of talk about that too?
Yeah, I think it's really good to get out of the house and get your kids out of the house. But when you do that, it's important to be mindful, again, of that social distancing, which can be more challenging, certainly with young kids and children, maintaining that 6 feet of distance. If you do go to the park, you have to be really careful if you're going to be on the playground, because playground is full of plastic and metal surfaces. And as Dr. Hammer said, that study earlier this week from the New England Journal of Medicine showed it can last for several days on surfaces, depending on how much virus was inoculated onto the surface. So those don't get regularly cleaned. And so it is really important to be mindful if they're touching anything that their hands could get contaminated, that you wash their hands really carefully or sanitize them. But in the best case scenario, just have them avoid touching, playground surfaces, because those are certainly high risk.
Okay. If anyone else wants to add anything else about that, they can.
I mean, absolutely 100% agree with social distancing. That's really important, but we have to be mindful of some of our elders and their isolation that they might experience. So being able to utilize the resources like video conferencing, video chats, telephone, being able to try to see what you can do to connect with your with the elderly who may not have the ability to get out. And so just being mindful and reaching out, making a phone call makes all the difference a lot of the time.
Yeah, I was seeing on social media, even people leaving notes on their neighbor's doors, but not knocking on the door, but hey, call me, text me if you need me to run to the store for you or do something for you. So just being a good neighbor and practicing that as well. And we are joined now by Dr. Eric Pershla from University of Colorado School of Medicine. Thank you for joining us, Dr. Pershla, also an infectious disease doctor. So we've to catch him up, we've been covering testing, the coronavirus living on surfaces, symptoms, but we've been really talking a lot about the testing issue. To welcome Dr. Pershla, I'll give him one of the questions we are getting about vaccines. So if someone's gotten the pneumonia vaccine or the flu vaccine, why will that or will that not protect them against the coronavirus?
Okay, because those vaccines protect against specific viruses, and this is a different virus, and so there's no vaccine out there now, and there probably won't be for about 1.5 years. But there are vaccines being tested right now.
Yeah, we did address with Dr. Hammer and Dr. Coley, that they are entering the phase 1 clinical trial for a vaccine, hopefully less than 1 year, but yeah, it's hard to know at this point. And someone just asked, is it safe to eat takeout food? We're being told to support our restaurants still, even though you can't dine in. Dr. Pershla, since you did just join us, maybe I'll let you answer this question again. Can the coronavirus be on our food if we're ordering takeout?
It's unlikely. It tends to survive more on hard surfaces like plastic and countertops and things like that. It's not out of the realm of possibility, but this virus isn't typically transmitted by food. And so I think it's still fine to have takeout. If you want to be extra careful, just heat it up to reasonably hot. But you're probably more at risk from touching the outside of something than eating something.
Okay, and Dr. Coley, I want to put a question back to you. We've gotten several questions about this, just having to deal with pregnant moms, nursing moms. I'm a nursing mom. I have a 4-month-old. Do we need to be concerned at all? Like, I'm not showing any symptoms or sick, but when would someone need to be concerned, and what's advice for nursing moms?
So they have looked at a small sample size of 9 pregnant women who then subsequently were nursing, who were infected with the COVID-19 virus, and there's no transmission of the virus in the breast milk itself. Having said that, there have also been case reports out of England of new moms who were working, holding their baby closely and caring for the baby, and because it's a respiratory virus, they transmitted it to the baby. Neonates who get this infection tend to do relatively well. Again, small case reports coming out of China that have shown us that in 9 babies under the age of 1 who were infected with it, none of them required the intensive care unit or required ventilation. But I would tell the new moms to be extra careful, because there's a high risk group in a neonate, because we have very small numbers and we don't exactly know in a baby that doesn't have an immune system yet exactly what the potential of this virus could be. So just use extra precautions when handling your baby, and particularly if you're feeling sick, you want to be real careful. Think about maybe pumping and having somebody else give the baby the milk.
Yeah, that's kind of what I've heard, is to still express milk, but then have someone else feed the baby if you're really worried about passing it along. And then again, if you are having symptoms, that is when you wear a mask, correct, Dr. Holy?
Yes, exactly. Knowing that the mask is not, fully effective in preventing transmission, but absolutely, if you're having symptoms, you should be wearing that mask.
Okay. Dr. Hammer popped back on. I want to give him a chance. Did you want to say anything else before you? Oh, man, are you?
No, I'm back.
Okay.
No, I agree with the study, but also the additional risk for contamination via respiratory secretions. That would be the primary concern. I totally agree with what was said before. I was actually trying to get off. I wish I was going outside so I could social distance, but unfortunately I have to go back to the unit. So thanks for having me on.
Thank you so much for taking the time.
All right, take care.
So Dr. Pershla, I wanted to put another question to you. People are asking about symptoms, that it's kind of confusing. When are you most likely to infect someone? When you have a fever, when you have a cough? I know you can be kind of asymptomatic too and have this. So can you just talk about when you're most likely to give this to someone else?
So you're probably most likely to give it when you're coughing. It's a respiratory virus, and coughing expels virus out into the air. That's why it's very good if someone is sick and has to go out in public to put a mask on that person. That's much more effective than actually wearing a mask if you're not sick and you're worried about getting it. Having said that, there is some emerging evidence that asymptomatic people without symptoms might be spreading this. There was a study published in Science just, I think yesterday, saying that a fair number of spreading incidents have to do with coming from asymptomatic people. That's not really clear yet, but it's certainly something to be considered, and it certainly seems to be in a certain percentage of patients that is happening.
Joshua Zucker, I want to give you a question. So, people are asking about, we talked about asthma being an underlying condition to put you more at risk, but also smokers. So what are you seeing kind of in an older population as far as smoking goes? How high is their risk of getting, or of having more complications from the coronavirus?
Well, I mean, we know that smoking is really rough on the lungs, and it's never too late to quit smoking. It's really important that you try to quit smoking as best you can. I mean, it's a tough addictive chemical, so it's hard for people to do, but it certainly it irritates the lungs and causes harm to the lungs and puts you at higher risk for chronic obstructive pulmonary disease. So when we talk about older people being at higher risk for having complications of the COVID-19, that's kind of people we're thinking of, are those people who have underlying health problems, and smoking and certainly is puts you at a much higher risk. So I was looking at the World Health Organization website, and there's this little section on there about what are the things you should not do. And the number one list is do not smoke. Smoking is absolutely not something that will help you prevent this illness, and in fact will probably make things worse. Also mentions not wearing multiple masks. That's not going to help you prevent the illness. And taking antibiotics, as we mentioned before, it's a virus. There are no antibiotics work on bacteria. This is a viral infection, so looking for antibiotics to fix the illness is not going to help you either. But absolutely, smoking is very hard on the lungs, and along with other parts of your health and your body. So absolutely, quit smoking as best you can. Even if you're unable to quit smoking, try to limit the amount of smoking you're doing, limit the harm that you're causing yourself.
Right. Some debates going on in the Facebook comments right now about this being an airborne virus. Can Dr. Coley, maybe you offer some clarification on, is it an airborne virus?
So a paper came out 2 days ago in the New England Journal of Medicine that looked at viral particles that were nebulized at high velocity. So they were kind of launched into the air and then checked to see how long they lasted in the air. And they decayed by about 50% every hour, but they lasted in the air up to 3 hours. And so technically that was called airborne because it lasts in the air on its own. And this is as opposed to droplets, which are respiratory droplets that fall to the ground with gravity and don't sustain themselves in the air like a fog. However, experts do believe that, having looked at that, it's not the primary mode of transmission in this virus, because if it was, it probably would have spread a lot faster than what we're currently seeing. So although there is some possibility that it may have airborne potential, we still think the primary mode of transmission is direct contact with respiratory droplets with the 6 feet or less of distance.
Dr. Persla, did you have anything to add as far as the virus living in the air, the droplets?
No, I think that was well said. You know, there is airborne risk, but that's probably a good summary.
Someone did have a question, and I kind of had this question earlier too. Family members, we're kind of social distancing, but should we, you know, not be going to family members' houses, keeping our kids in one house, not going to grandparents' houses or another family member's house? Maybe Dr. Persla, you can talk about that, I guess, about whether or not families should keep social distancing as well.
Well, I'll speak from a little bit of personal experience. My son just got back from Germany yesterday. He may have been exposed on the plane in Chicago, whatever. So we're keeping about 6 feet from him. He's eating downstairs, and we're talking to him, but we're not avoiding him. So in general, reasonable social distancing, not gathering in large groups. Probably not the time to have a large family gathering with all the cousins and everybody all over. So in general, social distancing, yes, is a good idea.
I want to reintroduce everyone again because we've been going for about 40 minutes. This is a 9Health virtual town hall. We will do several of these. It's your chance to ask your questions to several experts and get the answers that hopefully you're wanting to get. We'll do this until 5:30 tonight. We have Joshua Zucker. He's a nurse practitioner specializing in geriatrics and family medicine. We have 9Health expert Dr. Pyle Coley, who is a cardiologist but also internal medicine doctor. So she has a wide range of knowledge on a bunch of different topics and has been speaking great about the coronavirus, you know, since this all came about. And we have Dr. Eric Persla, who is the head of infectious diseases, and he's a University of Colorado School of Medicine professor. So thank you again to all of you for joining us. I can kind of continue. I'm just scrolling through Facebook, looking at some of the questions. Dr. Persla, maybe you can talk about, we keep saying it does affect an older population maybe more severely than a younger population, but I do feel like we're kind of seeing, you know, we're seeing cases in younger people and even severe cases. Can you talk about when that does happen and who it's really affecting most?
Well, first of all, it's very clear that there's a very steep age-related difference in vulnerability to the virus. So it goes up noticeably after 60, and then definitely after 65, but it's really above 70 and 80 in particular that you really start to see very significant effects on mortality and degree of sickness. The other thing that's very correlated with this is having underlying medical conditions like heart disease, especially lung disease, smoking induced or otherwise, probably diabetes, or being having your immune system suppressed if you have, say, an organ transplant or you have cancer and you receive drugs that have done that. So those are the really two things. I'll add to what was said before. We can be very reassuring at this point on pregnancy. There really isn't an association with bad outcomes or infection of the fetus as with Zika virus. And so there was another study out this morning, 38 cases that continue to reassure. There's no evidence of transmission across the placenta or in the uterus to the fetus. And what's really different about this is that with, say, influenza, we see a sort of effects at both ends of the lifespan. Very young babies, children vulnerable, and older people. Here it really seems to be older people and not children that are being affected. Now, young people in their 20s or 30s, yes, certainly possible, but not nearly even close to the degree that the things ramp up above 65, 70, 80. And that's why nursing homes are really a concern, because you have a population inside one building, very vulnerable. And so I think that's where we really have to be perhaps the most vigilant about quarantine and isolation type measures to prevent the virus from getting into nursing homes.
And Joshua Zucker, you work a lot with geriatric patients. What have you seen so far? Have you had any patients with it? I know we were talking about an issue with testing earlier and just getting tests to test everyone, but talk about what you have seen.
I think we're trying to do our best with the limited resources we have available. I think the state was very wise in following national guidelines of isolating our elders in assisted living. I think there's restrictions on visitors who are not healthcare providers, and to really try to minimize social visits. And so, our patients are much higher risk because of the comorbid other health issues they have, their age, the age of their lungs, and the other diseases that they have. So it really is, it's a strong concern for us. And so while we have to do the best we can to mitigate or to reduce the risk of the elders who are exposed to younger children, to people who might have a little bit of a cough and cold, may have the coronavirus and not be aware of it, we really need to make sure that we're protecting them as best we can. So again, on the flip side, we want to make sure that we don't isolate them so much that they're having the ill effects of being by themselves. So trying to reach out in different ways you can. I've seen different neighborhood apps where please send cards or notices to, letters to those who live in retirement communities, assisted livings, and nursing homes. So it's a tough situation. I think coronavirus is much more prevalent than we're able to test for, but we're doing the best we can. And unfortunately, they're the hardest hit.
Dr. Coley, people are asking also about how long does it take to recover if you get it, and just about recovery in general. We're hearing of some people recovering, but when do we get kind of updates like that about people as they get this and go into the hospital?
So the incubation period of the virus, or when it's replicating, is about 2 to 14 days. So depending on when you first experience symptoms, it can usually be about a week or 10 days until you're fully recovered from those symptoms. We're just now getting some data from the people who got the virus in January and now coming back for their follow-up visits about 6 weeks later from China. And there have been a few case reports of some people who perhaps have had permanent scarring or permanent reduction in their lung function after having this infection. So we're not entirely sure what the recovery period looks like right now, because we're just getting preliminary data from people who have recovered from this illness. But for the most part, it seems people tend to recover within about a week or 10 days and then have a pretty uneventful recovery. But as more and more people become infected and recover, we may learn more about the long-term effects of the virus.
Dr. Purcell, we keep getting questions as well about living on surfaces. We talked about it maybe being in your takeout food or not, but and most likely not, since you're going to heat that food up and eat that food. But what about living on packages? So like if we get a package in the mail from someone, what precautions should we be taking? Is it living on those types of surfaces?
That's extremely unlikely. And I think that question gets asked also, if my Amazon package came from China, do I have to worry? And the answer is no. That's very unlikely. And the virus can probably survive a little longer than other viruses, but it's still on surfaces, but it's still in the category of the fragile ones, which have what are called envelope viruses. So I don't think decontaminating packages you get in the mail is something that people have to do at this point.
Okay, and then another good question for you. Explain why this is different from H1N1.
Little too early to tell. So H1N1 is influenza virus. It's spread by a similar route, respiratory. I guess it's different in that it probably has a higher mortality. So the mortality of influenza viruses like that are fairly low, about 0.1% or 1 in 1,000. It's a little early to tell because we don't know really how many people don't have symptoms at all when they get infected or have only minimal symptoms. But on balance, the evidence seems to be that this virus does cause more deaths per person infected than influenza. And the other thing is we don't know, influenzas persist and become endemic or embedded in the population, come back year after year. We don't know if that's going to happen with this, but it probably has a good chance that it might do that and come back seasonally and circulate between the northern southern hemispheres. But we just don't know at this point.
Right. Joshua Zucker, a good question came in that might be good for you. And it's talking about just preventive doctor's appointments. So I had just my regular doctor's appointment earlier this week. I chose to not go to it. Should people be keeping those regular, preventive doctor's appointments, or should they be holding off on going to doctor's offices, to hospitals? My 4-month-old, I think next week has his 4-month vaccines too. So maybe that's a separate question on, him staying on schedule with vaccines, but should people be going to their regular doctor's appointments right now?
I think really it's important to, as a general preventative, I think I would think twice, but I think it's important to reach out to your healthcare provider, see what they have to say. Maybe call them up. They know your health much more than we can generally give advice at this point. But if it's just a routine or an elective procedure, I would seriously think twice about going to, and maybe it can be postponed until another time. But reach out to your healthcare provider, talk with the staff, talk with your healthcare provider, and make an educated decision for you, for your health and what your health status is before making that decision. So thinking about postponing, if it's something that's not urgent, you may consider putting it off, and allow for other people to make use of those that healthcare visit time if there are true illnesses that need to be addressed. So I think that truly urgent illnesses, but I think that reaching out, communicating with your healthcare providers, figuring out what the best fit for you based off your needs is probably the best option.
We keep getting this question. Oh, go ahead, Dr. Purcell.
I wanted to circle back. You may have covered testing fairly well, but I just wanted to emphasize a point. We'd love to be able to test everyone so that we could, most maximally isolate and home isolate, so forth. But right now we don't have enough tests to do that. And we're probably not going to for a while, especially as the community transmission in Colorado increases. So what we're recommending now is that we really only test high-risk individuals, and I'll elaborate on that in a second, healthcare workers, and hospitalized patients. So people who are mildly ill, a little bit of cough, but not really short of breath, young, should be encouraged to stay home and home isolate. Now, if you fall into a high-risk individual category, by which we've already talked about, I mean, over 65, diabetes, serious underlying health conditions, lung disease, had cancer, been on chemotherapy, or had an organ transplant, or had a bone marrow transplant, things like that. And there's a list of other things that are more specific. But if you don't have underlying heart or lung disease or one of those serious conditions, and you're not over 65, and you have mild illness, we don't think it's necessary for you to be tested right now, because we need to reserve tests for the hospitalized and those groups. Does that make sense?
Right, and I might want to give Dr. Coley a chance to chime in on testing as well, and kind of clearing up the confusion that people might have. We keep getting questions on YouTube and Facebook that say, I have symptoms. I think I have symptoms. We have community spread, but am I supposed to say that I came in contact with someone, or I traveled to another affected region? Kind of help clear up the confusion with testing as well.
Yeah, I agree with everything that's been said, but I think there's a difference between what we want and what's realistic and possible at this time. So if I had a genie and a magic lamp, I would say I would want to test as widely as possible so I can understand exactly what the virus is doing, and I can understand what the mortality of the virus is. Not so much because it's necessarily going to inform my choices or the way that I treat my patients, but more so to understand the virus, because this is a novel virus, and that's an important thing to do in general. But given the current limitations of our testing, the frustrations with getting testing, the turnaround times, and just the inability to keep up with the amount of testing we'd like to do, we really have to try to now focus our testing on people that are higher risk, on people that are likely to decompensate, on people that are likely to be exposed, and on those people who need hospitalization. So again, difference between what we want and what we can do. But for everyone listening out there, it's important to know that it's frustrating, and it's frustrating for us as medical providers as well. But calling or going to an emergency room, if you're not necessarily in one of those high-risk groups, isn't going to get you, probably isn't going to get you a test. So I think instead we all need to kind of realign our strategy and think about really focusing on the vulnerable people and trying to utilize the limited testing resources that we have in a high yield fashion.
And just speaking of higher risk, we've gotten a couple questions, about underlying conditions. Pulmonary hypertension, I'm guessing your risk is higher, but maybe touch on that a little bit. And Joshua Zucker, I don't know if you touch on that as well.
Yes, that would be considered high risk. Pulmonary hypertension, definitely.
I agree.
So pulmonary hypertension is, high blood pressure in the lungs, so to speak, but it puts risk on both the lungs and the heart. So yes, that's a high risk condition.
And even just, regular high blood pressure is a risk factor, right?
Yes.
So I'm just looking at Facebook, trying to get our questions. We are on here until 5:30. So if you have questions, post them to Facebook, post them to YouTube. We'll try to get as many answered as we can. You can keep posting them. We can answer them later as well. Too. How do you know if someone has shortness of breath? I think, you go up for a jog, you have shortness of breath, but what does that feel like for someone that may not have experienced that with illness? And any of you can kind of answer this. I didn't call out anyone, but maybe Dr. Coley, we start with you.
So I say, look for a few things. One, a change from your usual. So if this is something new or different than your usual, then that's a red flag. The other thing is, when you run up a flight of stairs and you're short of breath, you're not necessarily going to get that kind of shortness of breath where you're huffing and puffing for air, but you may just notice that you're getting a little more winded doing the things that you were normally doing before. And that can be simple things like climbing stairs or carrying a bag of groceries. You're not necessarily going to have that feeling where you can't get a word out, but you're just starting to feel like you can't quite catch your air. So I would say a big change or subtle symptoms and signs that, maybe your exercise tolerance or stamina has gone down. Those are both what I would consider risk factors or risk signs that you might be having some shortness of breath.
Dr. Pershla, we've talked a little bit about this. We talked about, when we might see a vaccine, but once you get the virus, you have some immunity. Are you then immune? Do you still need to get a vaccine when that comes out?
That's a good question. So undoubtedly there's some immunity. We don't know how much at this point. There's some evidence that the immunity wanes with time, but at this point, we're not going to have a vaccine for another 1.5 years. So we have time to figure that out, how long people retain, for example, blocking antibodies in their blood and so forth. It's a reasonable expectation that people will develop some immunity. How long it will last isn't clear. So I think that's an unanswered question and something to keep an eye on going forward.
And maybe for those that don't know, you can shed a little light on this. A year might seem fast to those that know how long vaccines can take, but why does it take as long as it takes, and what is the process for getting a vaccine?
Well, so right now there are a number of things being tested, different ways to do a vaccine, and then those have to go into what's called phase 1, where they're tested for safety and not causing harmful side effects. And then it takes a long time after you vaccinate a population to then track them and figure out who got the infection and who didn't. And so that takes time and couldn't be completed. If the current epidemic would end in the summer, we wouldn't have the evidence for that before at least the summer. And then the vaccines have to be tested in a larger population to make sure they're safe and work. So all that takes time. It can't really be speeded up very well. So it's a pretty complicated process to go from something that seems to work in, say, mice to something that can be broadly administered to the population.
Joshua Zucker, you can touch on this a little bit, maybe talk about the treatments if someone were to get it. So if you were to have a patient that had coronavirus, COVID-19, what would be the treatments that would be started?
Well, at home, we're going to do our best to keep you at home, keep you hydrated. We're going to work on preventing your fever using acetaminophen, a Tylenol. Of course, making sure we don't get too much of the Tylenol, because there is too much of a good thing. And so try to reduce the fever, working with medications to help with cough, with congestion and so forth. But really the best options are to, as we call, supportive measures. We're not going to be, there's not a medication I can give you here, take this pill and you'll feel better. It's letting the virus run its course, trying to help you stay as healthy as you can, preventing the illness from getting worse. Hydration is really key, of course, within reason with your other healthcare concerns. But really, it's if you're having that shortness of breath, as Dr. Coley had mentioned, walking up the stairs, running up the stairs, and you feel that difficulty getting a good deep breath, but that's happening at rest, and you're feeling that's a significant change from your baseline where you're normally at, that's something to be concerned and reach out to your healthcare provider.
And Dr. Coley, this might be a good question for you on YouTube. Someone asked, they've just finished radiation treatment. Maybe you can talk in general too about, cancer and the risk to a cancer patient. Is it different no matter what stage of the cancer they're in? But if they've just finished radiation treatment first, is that considered high risk?
So a little bit depends on what part of their body they got radiation to, whether it affected their bone marrow, which is what makes your immune cells. So hard to know exactly in this situation, but in general, cancer patients who have completed chemotherapy and or radiation because of the side effects of those treatments are certainly considered higher risk. And sometimes depending on the type of cancer, if it's a leukemia or a lymphoma, the cancer itself also affects the immune system and can also make you higher risk.
And we did have a couple comments, that we're making people scared, we're causing fear. Again, we're just trying to deliver the facts to you, ask questions that you have. But while we're talking about that, I don't know if any of you can provide something maybe positive that we can focus on for just a moment. Dr. Coley, you've covered this extensively on 9 News. Maybe you have something positive that you've seen in relation to the coronavirus.
Yeah, I think a few positives, or silver linings, as I like to call them, stand out to me. The first is I think that it's, the togetherness, the community togetherness. And for me, I've never felt so connected to the other people in my community, and because we're all fighting this thing together. And I think that's a real positive that's come out of it. The other thing that I've really found, encouraging and happy for me is that people have started thinking about their health, thinking about taking control of their health and preventive measures like they've never done before. And that's really empowering as well. And it's unfortunate that it took a pandemic for a lot of us to start doing that. But I think that that's really a positive thing. And hopefully, even after we're through all this, that effect will last. So I think it is scary. It's a scary time, and it's important for us to acknowledge that. And even healthcare providers feel scared. You've probably seen on social media a lot of people talking about the lack of personal protective equipment and the risk to us as providers. But I think you have to recognize the fear is amongst all of us, and we're talking about it not to induce more fear, but actually to empower you with that information so that you can use your behavior to help change the behavior of the virus. Because the more we know, the more we can prevent the spread of this thing.
And just talk about health. Go ahead, Dr. Persha.
I'd just like to echo that this is a scary time. This is really unprecedented. But we, as a country, we've been through really some dark periods before, and we've gotten through them. We're going to get through this. I think when we're going to get through this, as was just mentioned, by keeping our sense of community, everyone doing their part, not going out and congregating. And if we do that, I think we can get over some of these initial things. It's a little hard when we're constantly bombarded now, social media, the web, TV, with this or that latest panicky thing. But there are going to be some sad things. People are going to die. But I think we're going to get through this. And if we stick together and each person plays their part, listens to guidelines, listens to health authorities, I think we're going to be okay.
And speaking of positive, someone asked about volunteering right now. They volunteer with the Red Cross. Should they continue to do that? What other precautions should they be taking? Just talk a little bit about, maybe Dr. Coley, you can talk about this. Should people be volunteering right now? I know I saw something earlier about, they need people still to donate blood. Is that safe? Some of the good things we want to do to help. What can we do to help?
I think volunteering is a little tricky because it depends on the circumstances of the volunteering, how close contact you're going to have with others, particularly if they're a high-risk group. For example, if you're volunteering in a nursing home, I would say that's probably not a good idea right now because you're going in and out of there and you could be potentially bringing in the infection. So that's going to be on a case-by-case basis, really. The blood question is an important question. The American Red Cross is encouraging people to donate blood because there is a nationwide shortage of blood, and a lot of their blood drives have actually been canceled because of social distancing. Having said that, we don't yet know about the infectivity of blood that may have coronavirus. We talked earlier about people being asymptomatic. So if you have no symptoms, you could potentially still have, the viral particles in your blood. And we don't have a test available at this time that's looking for antibodies or looking for viral particles in the blood. So I would reach out to the American Red Cross and see if they're accepting blood donations and follow their guidance on this.
And we did talk a little bit about, our health providers in hospitals. Dr. Coley, you mentioned on social media, we may have seen some of, friends that work in healthcare that are frustrated because they don't have the right personal protective equipment. And Dr. Pershla, maybe you can touch on this. Are there any resources for those healthcare providers that maybe feel that they don't have what they need? Can they get what they need? What are options for our providers?
Well, every effort is being made inside the hospitals and clinics to triage the personal protective equipment to people who need them. And so that's why it's really important to not use them when we don't need them. So the average, just to make a broad statement, the average person walking around on the street now does not need to be wearing a mask. We are asking people to wear masks when they come in our hospital and things like that. But if you're out going shopping in Safeway and things, you really don't need a mask, and you don't need to be hunting them, especially for the N95 ones. So it is a concern. There are various efforts being made to address that. I heard this morning that construction companies apparently stockpile huge numbers of these N95 masks and are going to be donating them. So there are ways to get around it, but it is important to conserve these things for exactly where they're needed.
And will you see, when you go to a hospital, will you see, healthcare providers mostly wearing those N95 masks, or are those part of the shortage of supplies? Are surgical masks something that they would be wearing? Even though we talk about those not being as effective, would they be wearing those?
So
because that's better than nothing.
last week, all practitioners are asked to wear a mask. All healthcare personnel are asked to wear a mask walking around the hospital. Those can be the regular paper yellow ones. They don't have to be N95. N95 is when you're in contact with a known patient or high-risk patient. And so that's a different story. But yes, people are wearing masks, and you will see that. It is a different scene now in the hospital.
For sure. Dr. Coley, we've gotten this question a few times, and so I'm going to put that out there, but people are asking about their pets. And I think we've talked about this topic a few times, whether your pets can get it, or more just are your pets kind of carriers of it, maybe on their fur. Can you talk a little bit about what you know about that?
Yeah, so the coronavirus is a family of viruses that can infect, pets, including dogs and cats. But this particular coronavirus, which is called the SARS coronavirus 2, as far as we know, is a human virus and not really known to infect pets. Having said that, the CDC does have some guidance that if you think you're sick or you're feeling any kind of symptoms at all, you probably should not be the primary caregiver for your pet until we get more information about this virus.
So we know, just to add on a little bit, we know that this virus came from another mammal like us, and probably a bat, and maybe it transitioned through an intermediate mammal on the way to us. But that doesn't mean all mammals like dogs and cats will be infected. There's no real evidence for that now. So I think it's reasonable to not kiss your dog, but I don't think you have to it's pretty hard if you have a pet to stay away from a dog, right? So I don't think that's a strong recommendation at this point, but I understand why the CDC is having that guidance up there in case that it does have more broad spreading ability to other mammals that we don't really know about. But there's no specific evidence for that now.
Do we need a routine for bathing our pets like we have washing our hands too, just for them as a surface?
I don't think that's a significantly effective intervention. I wouldn't do that.
And I did want to, go ahead, Joshua Zucker, go ahead.
I think it's important, just good hand hygiene is a really good idea. Wash your hands before eating, drinking, wash your hands after touching surfaces. Just being aware of what you're doing with your hands and where they're touching, and make sure that good overall hand hygiene. You don't need to worry about, is my pet more risk than my Amazon package or my other package? Just good hand hygiene will make a world of difference for making sure you're keeping your health. So I think that nothing specific about your pet, but something, just being good hand hygiene overall. We all listen to what we were taught in kindergarten and preschool. I think we'd have a lot healthier situation. So just good hand hygiene.
Right, and we did talk about, you know, treatment that you would get if you go into the hospital and you test positive for coronavirus COVID-19. But Dr. Coley, can you talk about, and Dr. all of you can probably touch on this, but are there any specific medications or treatments that have been used that are positives, and then maybe even like natural remedies? You know, I see on Facebook people talking about taking their elderberry syrup and things of that nature. Touch on medication specifically.
So in terms of medications, I know there's a number of medications in clinical trials, including antivirals that have been used for Ebola and HIV in the past, intravenous vitamins at high dose, as well as things like steroids. But we're still waiting on the results of the efficacy of these types of interventions. There's no consensus on anything that's really worked. In terms of interventions that you can do to boost your immune system, I think if you have a vitamin deficiency or at risk for a vitamin deficiency, like you've had a gastric bypass or have an inflammatory bowel disease or have had part of your colon or gastrointestinal tract resected, then you may want to talk to your doctor about supplementation, because people who have vitamin deficiencies can be a higher risk for contracting certain infections like vitamin C deficiency, vitamin E, and some others. But if you have a pretty well-balanced diet and pretty healthy, there's no evidence that high-dose vitamins actually boost your immune system. Instead, I would recommend things like, you know, getting 7 to 8 hours of sleep, because sleep is important in immune function, keeping your stress levels in check, because cortisol, which is a stress hormone, can suppress the immune system, and making sure to get the regular exercise.
I need you to tell my newborn that I need that much sleep so that I can boost my immunity.
I'll send him a letter.
So I'm just going through questions again on Facebook and YouTube. We have gotten this question a couple of times on YouTube, and I just am now seeing it. And Joshua's agree, you talked about smoking. They're asking specifically about smoking marijuana. I'm thinking smoking of any kind, you know, that's damaging to your lungs is going to put you in a higher risk group, but smoking marijuana specifically, does that put you in a higher risk group, or is it beneficial in some way?
I don't think there's any evidence to say that marijuana is beneficial for any kind of respiratory illness. I think that when you inhale any kind of particulates, any kind of incinerated particles, you're damaging your lungs. I know there's a fair amount of people who wish that marijuana has more research to prove it's beneficial, but there really isn't data there. And when you're burning chemicals in inhaling your lungs, those lungs are not meant to deal with burned inhaled burned particles. So really, my guess is, and again, the data's not really straightforward, but there really isn't a whole lot to say that this is a good thing, and highly likely, this is really bad for you. Like cigarette smoking, like other things, pollution, they're all harmful to your lungs, and so really, it would try to avoid as much as you can.
Hey, Dr. Persh, go ahead, Dr. Persh.
There's about 4 drugs now that seem to have some evidence for them. And that are being used in hospitals. And there's one very specific one called remdesivir that isn't approved yet. But those will only be administered if you are admitted to a hospital, especially the remdesivir. So there's really nothing that people could take at home that would specifically block the virus. There's no supplements that are known to do that. Steroids aren't going to help, and they hurt. So really, there aren't supplements or pills or vitamins that we think are really going to protect. It's really what you just heard. Hand hygiene is probably the biggest behavioral thing that you can do in your daily life to prevent transmission. I want, in regard to medicines, there's been some publicity in the last couple of days. The French health minister told people not to take Advil or Motrin and also ibuprofen. And there's really not good enough evidence now to tell people not to do that. You can also take Tylenol, also known as acetaminophen, for fever or muscle aches or things like that. I wouldn't at this point tell people that you shouldn't take Advil or Motrin or ibuprofen.
Yeah, we had discussed that a little bit earlier, whether or not ibuprofen was beneficial or harmful if you had coronavirus or had symptoms of coronavirus. I did want to ask, we keep getting these questions on Facebook about the weather, the temperature. Can the virus survive cold weather, hot weather? What does temperature have to do with anything? Dr. Pershla, can you kind of touch a little bit on that? And maybe Dr. Coley as well. I know you've talked about this on 9 News.
Well, it can certainly survive cold weather. So cold is not going to inactivate it. Anything that might prolong it. In regard to heat and humidity, there's been much discussion about whether when the weather gets warmer in the summer, whether the transmission will decrease. That may happen with some other viruses that are seasonal. We just don't know enough about this one, so I wouldn't count on that. It's something to hope for, that as the weather warms and not so much in Colorado, but elsewhere gets more humid, that you might see a decreased transmission for a variety of factors. Certainly heat, heating things up to the really hot or boiling would absolutely instantly kill this virus. And it doesn't have to be like glowing hot. But cooking, and again, cooked food is really not the way this is transmitted, but heat does inactivate the virus.
And again, we're doing this 9Health virtual town hall. We have about 15 minutes left that we'll be doing this. I have Joshua Zucker on. He's a nurse practitioner specializing in geriatrics. We have Dr. Eric Pershla, who's from University of Colorado School of Medicine, infectious disease. He's an infectious disease doctor. And then we have our 9Health expert, Dr. Powell Coley. And we're just asking them your questions, getting your answers. We'll do this again next Wednesday as well from 4 to 5:30. But again, we have about 15 minutes left here that we can chat. Someone did just ask, should we let our kids play outside with the neighborhood kids? So I've seen my neighbors out playing. Do they need to just be keeping their distance from each other still and practicing that social distancing even when outside? Dr. Coley, I'll let you answer that one, just about playing outside with our neighbors.
Yeah, I think you've heard me say this before. It's hard to keep kids contained and keep them indoors. So I do encourage them to get out of the house. Again, if they are going to be interacting with other kids, make sure they do try to maintain that social distancing, because kids are really those asymptomatic carriers, is what we're learning from the latest evidence. So they themselves may not even be sick, but they may, be bringing it from one household to another. So if it's hard to do that, then I would avoid the play dates. But if you can, your kids are older and they can maintain that distance, then that's the way to get them together.
All right, I'm just looking through our questions, seeing what else we could possibly ask you guys. We're going to kind of be repeating, so I apologize to our doctors that have been on with us this whole time, but some of these people, pop on and off. Let's see. Someone, they joined a little late. We had covered nursing mothers and pregnancy a little bit. Maybe Dr. Pershla, I don't know if you can talk about just the risk to pregnant women. Are they in a higher risk group than you're just an average adult, kind of like they are with a lot of viruses?
Yeah, so I'd like to reassure about pregnancy. There really hasn't been evidence for either increased vulnerability of pregnant women, who are sometimes more vulnerable to infections like, for example, tuberculosis. That doesn't seem to be the case here as far as we know. It's a little bit early. Pregnancy is a 9-month process. This virus has been with us for, 2 months. But there isn't evidence now for transmission through the uterus into the fetus. Certainly there might be some transmission after birth. But they don't appear to be big factors. So I would basically, pregnancy is a time where we can be very anxious about all our exposures, and but I would encourage pregnant women to be reassured that this does not appear to be a virus that's really affecting pregnancy at this point.
Right, and I think Dr. Coley, you talked a little bit about it as well. Maybe we can just talk about the recommendations for nursing mothers while we're on the topic again. Just recommendations for someone that is breastfeeding or has a baby that's nursing.
Yep. So if you do become infected with the virus, it's probably a good idea to, express the breast milk because it's not seeming to be transmitted through the breast milk, but maybe have somebody else feed the baby, because it is a respiratory virus which can be transmitted with close contact.
And then we've gotten this question on here. Well, we kind of have this question in general, but they don't want you going to the hospitals, going to your doctor's office without calling first, just to make sure you do have the symptoms that I guess would check out to warrant going in. But can we talk about, have any of you done telehealth with any patients? How does that work? How would you kind of assess someone using telehealth, whether or not they have coronavirus or COVID-19? And I'll let Dr. Pershla talk about this first, so they've done any telehealth at their hospital.
Well, we are ramping up telehealth, so-called virtual visits for this now. So that's happening. It can be done. There's some drawbacks, but it certainly is something to increase right now. And I'll let the other providers say what they've been doing. I have not done virtual health telehealth yet with any of the patients.
Dr. Coley, did you want to touch on maybe what's being done if you've heard any colleagues talk about using, virtual visits, telehealth?
Yeah, I think there are a number of practices that are really pushing for that. And I'm a big fan of it because I think it allows us to continue to interact with our doctors. And the downside, obviously, is they can't do the physical exam, but they can still assess a lot of the symptoms. So I think there's kind of two uses for it. One is for the routine preventive care, because during this difficult time, we don't want that to fall through the cracks. So if you need some kind of preventive thing or something, it's important to check in with your doctor and make sure that you can put that off. And then the second is obviously if you're having symptoms, and I think really trying to identify those people who would benefit from testing, because if your symptoms are mild and can be managed at home, you may not need testing. But if you're in a high risk group or your symptoms are progressive, that telehealth visit may really help to bring that out if you yourself aren't sure whether to go into an emergency room to get tested.
And Joshua Zucker, I know you do home visits a lot with your patients. What are you doing now that you can't, or maybe you are still doing that, but what precautions are you taking?
Oh, we're doing a higher level of screening of whether a person has more likely to have a infectious process, maybe COVID, making sure that we're utilizing our skills properly, make sure that what can we do? Can we convert a visit from a house call to a telephone visit or a virtual visit? Just to be aware that the virtual visits or the telehealth has been around for a long time. A lot of areas of our country and even Alaska have utilized the telehealth. Being able to, this is it's relatively new for our society. We've been doing this a lot, and so there's a lot of resources out there. A lot of our healthcare systems have used this in the past, and will move this forward. So we're being more cautious. Make sure we're making using what personal protective equipment we have. Make sure that when we do make a visit, it's most appropriate, and what we can for those visits we can do virtually. We will make sure we use those services.
And we just got the question, for those people who don't have a doctor, what would you as providers recommend to someone? I know at 9Health, we do have resources. If you need a doctor, you can contact us. And I was trying to pull up some information for everyone, but I'll put it in the comments. But Dr. Coley, if someone doesn't have a doctor, have a provider, what should they do if they start experiencing symptoms?
So I think that's a good question. The state has been telling us that if you go to their drive-up testing facility, they do have a nurse or an epidemiologist on site who can assess you and actually help to triage you and determine whether or not you're an appropriate fit for testing. So I would say that would probably be the best place to start. But 9Health is currently working on trying to provide telehealth resources to these types of patients. So hopefully stay tuned and we can come up with a solution.
And I know we're really good at connecting with clinics as well. If someone does need, they don't have insurance, they need a resource, we can connect you with some clinics as well if you need that.
Sorry.
Go ahead, Doc.
I've done a great job over a number of years, and I've volunteered at a number of sites over the years. There's always resources available. If you don't have healthcare services that you're connected with currently, there's a lot of resources that 9Health Fair has been able to connect with low cost and free clinics that are available out there based off your financial needs. So 9Health Fair has been for many, many years helping connect those members in our community with those resources that are available to them. So I think 9Health Fair does amazing work for that and that aspect.
We've been talking about social distancing, keeping our distance from each other to slow the spread of this. We talked about kids, if they can go outside and play with their neighbor friends, and we said to avoid playgrounds in case it is living on surfaces, but someone just asked about dog parks. So taking our dog out, is it okay to go to the dog park? Do we need to keep our dogs away from other dogs? Just maybe touch on that again. Dr. Coley, I'll let you answer this one.
Yeah, as was said earlier, we don't have any evidence that it's virus, the dogs are carriers or that they're infected with this virus. So, I mean, the only point of social distancing your dogs is really to social distance the owners, so to speak, because they're the ones that are going to be exchanging it. So if your dogs are running around in the corner by themselves, that's probably okay, but you should make sure you maintain that distance between the two dog owners.
And someone just asked a specific question, is Graves' disease a risk factor? Dr. Pershla, can you tell us what Graves' disease is for someone that might not know, and is that an underlying risk factor that would put you at high risk?
Well, yeah, it's a thyroid condition where the thyroid is affected by the immune system. I'm not aware that it is a specific risk factor or that it's terribly so-called immunocompromising. So I don't know of any evidence yet that that would be I don't think that's really on our list at this point.
And we've touched on this a little bit, but it keeps getting asked. We talked about the temperatures outside. As we approach spring, Dr. Coley, will it slow down the virus, the warmer weather?
We're hopeful, but we don't know. And we're hoping that it behaves like the flu, where the activity wanes during the summertime. That happened with SARS as well, where it started in November and by July of the next year it was contained, but that was a little bit of a different virus. We are seeing some activity in warmer weathers like Australia and some of the warmer climates. So it's really hard to predict whether or not the weather is going to impact it, but we're certainly hopeful that it will.
And Joshua Zucker, people are talking about symptoms again. Can you just reiterate what the symptoms are? Is fever always something that you will have if you have coronavirus, COVID-19? Just go over that again for us.
So generally, we're looking for a dry cough and a fever, and shortness of breath, a difficulty breathing. Feel like if you've run a marathon, but you're sitting still, having the same symptoms, having the same feelings. Those are the three major things we're looking for. Unfortunately, as we get older, our general temperature decreases. As you notice, little babies, and you were talking about your little one, babies can produce a really high fever. But as you get older, through the trajectory of the lifespan, just as you get older, things slow down. You can't ramp up a temperature as well as you could when you were younger. So keeping those three in mind, talking with your healthcare providers, talk to your nurses, your nurse practitioners, physician assistants, your physicians, having those open lines of communication. But the main thing is if you're feeling the triad of a dry cough, the difficulty breathing, and the fever. Now, 2 degrees above baseline is what the American Geriatric Society recommends is 2 degrees above Fahrenheit above baseline is what a fever is. So keeping that in mind that there's not a specific number we're looking for, especially if you're older, but being aware of where your baseline is, where you are. But if you're feeling sick, having a high fever, the difficulty breathing, and a dry cough, that is more concerning. But as majority of the time, we're going to be able to help you feel better with just supportive symptoms. There's not a magical drug out there that can stop the virus and reverse it. We're looking at helping you try to manage this at home with fluids, with acetaminophen, to make sure it's not beyond what the package recommends. Lots of fluids to help within reasonable amounts based off your health conditions, but really helping support you as best we can. If you're having this real difficult time breathing and have that fever, certainly reach out to your healthcare provider. They'll be able to direct you the right direction to go to the right place.
And we're kind of wrapping up here. We have just a few more minutes left. Dr. Purcell, I did want to ask one more thing though. People keep asking about vaccines, different vaccines. So if they've had pneumonia vaccine, will it lessen the symptoms of coronavirus? Talk about that a little bit.
If they've had the pneumonia vaccine, will it decrease the chance of coronavirus?
Will it decrease their symptoms? So will your symptoms not be as bad if you've had the pneumonia vaccine?
Yeah, the short answer is no. Those vaccines protect against pneumonia. And so we don't think that it is important to have them, though. It's valuable to have them because sometimes when people do get a viral pneumonia, like with the coronavirus, they then go on to get a bacterial pneumonia, and not necessarily the one that the pneumonia vaccine protects against, but certainly you don't want to be vulnerable to both things now. But they wouldn't offer specific protections against the coronavirus, no.
Okay, and then someone asked a question I liked, and I'll let you guys all answer this, and then we'll start signing off here. How can someone give thanks to the healthcare workers? So we are all very thankful to the healthcare workers that are on the front lines of this, risking their own health to take care of all those people that are sick. What is a way to thank healthcare workers for what they've done, what they're doing? Dr. Coley, I'll let you start.
Okay, so I would say just try to protect them. Be mindful of exposing them. Be mindful of stressing them out, placing undue demands on them. They're all working very hard at this time. And as you pointed out, they're risking their personal health and their family's health to really put all hands on deck to take care of patients with this novel coronavirus. So just try to be mindful, be kind to them, and be thoughtful about exposing them to undue risk. I think that's the best way that you can really express your thanks.
Yeah, follow the rules.
I like it.
And that's the best favor you can do.
Wash your hands. That makes me very happy.
Thanks.
All right, well, I'm gonna wrap us up here. Thank you all so much for joining us. Again, we were
One more
joined
minute.
by, oh, go ahead.
We have one more minute. I just
Sure,
noticed on our list of conditions that we talked about high risk, we didn't talk about HIV. There are thousands of people in Colorado living with HIV. And so the question may come up, if I have HIV and I have a cough, do I necessarily have to get tested right now? The answer is the vast majority of people are on medicines that are controlling the virus. If they'll know what this means. If their CD4 count is above 200, they're healthy. They don't really fall into a high risk category, but those who have advanced HIV, CD4 count less than 200, then those people are at risk. And then
That's a great point.
remember, it's not so long ago that viral disease was completely desperate, and now look, that it's as easy to treat, if not easier than diabetes. So progress happens.
Since you brought up HIV, I will ask you a question that got asked to me the other day that I wasn't aware of the data on. But if you're have HIV and are on an antiretroviral, are you less likely to have viral replication occur? And does it decrease your risk of becoming infected with this virus because you're already taking the retroviral?
Well, it's a great question. We don't have any specific evidence for that. And one of the classes of medicines being used now to treat is something called Kaletra, which is an HIV drug. And there seems to be a little bit of evidence in China that may work for people who have the sickness. I have to say it just came out today in a study that it doesn't work in another study. So it's really up in the air whether that works. It's theoretically possible that people who are on those drugs, especially what are called the protease inhibitors like Kaletra, but there are others might be protected. But I wouldn't hang my head on that. And certainly someone who's on a protease inhibitor should take no less precautions with hand washing or social distancing than anyone else.
Thanks.
All right, I just want to once again thank all of you for joining us. We will do this again next Wednesday from 4 to 5:30, this 9Health virtual town hall. So bring your questions. We'll have, so far we'll have Dr. Powell Coley joining us again and our 9Health experts. And then we will also have a psychiatrist that will join us as well to kind of talk about the mental aspects of this, taking care of our mental health, especially as we're all staying inside of our houses, maybe already going a little crazy after a few days. So we'll talk a little bit about that as well. So again, join us next Wednesday from 4 to 5:30. We'll be live on the 9 News Facebook page, 9Health Facebook page, the 9 News YouTube page as well, and 9news.com. So if you have any additional questions, you can bring those there. But we are also answering your questions whenever you have them. So feel free to contact us on social media. I'll put the email for 9Health if you need to reach us when we're working remotely, and the phone number. But again, thank you to all of you for joining us, and we will wrap this up and sign off. Thank you so much.
Thank you.
Thank you for the opportunity.